What's going on, everyone? It's Joe Yoon, aka Joe Therapy for Just Therapies, creams and lotions. So if you're in the market for some creams and lotions or just want to give it a try, make sure you go down to the description and check it out. But today we are going to go over a subscapularis technique, one of the rotator cuff muscles. So if you're an overhead athlete, if you do a lot of internal rotation like baseball player, swimmer, tennis player, this issue might pop up, some injuries to the subscap. So first thing is we have to go into the armpit for this one, and a couple tips here. We need to make sure that we're going in far enough. One of the big things I see all the time with therapists is they don't go deep enough into the armpit to actually reach the subscap. And so let's go through that right now. And I'm just using I'm gonna go in with my fingertips. You can go in with your thumb as well, but I like to place something over my fingers. I have a pillowcase. If you have like a t-shirt that you don't wear anymore, or maybe even like a paper towel, that's gonna be way better than poking your fingers and jamming it into someone's armpit. So we'll go ahead and go in here, and we're going right into the armpit. I like to hold onto the arm and get that client to relax the arm as best as possible. And I like to bring it in so the armpit skin isn't stretched. And then from here, we're going to just go in with the fingertips, the pads, and going right, almost like you're going straight towards the person's neck and clavicle, and going right in. And you have to go in pretty deep here, and then you drop down and press straight down right onto the subscap, okay? So one of the common things I see, I'm just gonna take the pillowcase off for now, is a lot of times I see the therapist go in and they barely go into the armpit and then they drop down. And most of the time you're just on the lat here. You're just on the lat portion of, or the lat muscle, instead of actually going all the way in. So let's show it again. Show it again. We're going to go all the way in, okay? So right here is usually where I see people stop and then go press down. Maybe you get a little bit of that subscap, but you're pretty much just on the edge of the scapula. So we're gonna go in, keep pressing. So we're going straight towards the head this way. I'm still going, and then drop down onto the subscap. And when we're here, we can add some motion. We can just press down, or we can add some external rotation while we're on the muscle to get that active motion. So that's it, but one thing I do want you to be careful of, there's a bundle of nerves that go right into the armpit. So if the client starts to use their fingertips, they start doing one of these, or you can just ask them if they start feeling some numbness, tingling down the arm, especially when you're doing the external rotation, then just back off, re-enter the armpit, and then go down and redo the massage. So again, if they start feeling numbness, tingling, arm falling asleep, make sure you come out of it, let them relax a little bit, then go back into the treatment. So hopefully you enjoyed that, and that is the subscapularis massage.